Can I raise a related issue in terms of what we're dealing with here today? And that is, in your evidence this morning, Mr. Hession, you made the point that, look, this really came to the fore during the pandemic in terms of the impact in relation to the pandemic unemployment payment, and the current rates were insufficient to meet the costs and commitments that people have. And an issue that I've taken up with you and taken up with the Minister previously when she was here, and that is the whole area of long COVID. So while what's before us here today is motivated by the COVID pandemic and the initial illness that people have had, the longer term implication is not yet being addressed, not by the Department of Health, never mind the Department of Social Protection. Now, 2 weeks ago I published new poll data which shows that 10% of the adult population has now experienced long COVID symptoms after a period of initial infection. And that 10% rate has gone up from 6% in the last 4 months over that poll period. And of those people, we have 17% of them have reported that their ability to conduct their daily activities has been severely affected. And disproportionately, it's impacting more on women than on men. And as a result of that, it's disproportionately impacting on lower income thresholds and lower income households. Now, as you know, look, long COVID is having a significant impact on the workforce and in terms of our welfare, both in terms of the welfare claims and the impact on lost work. And your own department has provided me with figures that have shown that 0.8% of those who contracted COVID-19 and claimed the enhanced illness benefit payment were medically certified as being unfit for work 12 weeks later. And if that was extrapolated across all of the people that contracted COVID-19, we're talking nearly 22,000 adults across the country. And that excludes people who relapsed after the initial recovery. Now, the Department of Social Protection data is also showing that 35% of workers on those disability payments after COVID who didn't return to work were still out of work 6 months later. Now, the two questions that I have for you, one is in terms of defining long COVID as an occupational illness. The Minister, when she was here before the committee last, has given a commitment to look at this to have long COVID listed as an occupational illness. And I know that she has already engaged with the Minister for Enterprise, Trade and Employment in Taoiseach and the Minister for Health in relation to that. Now, while you may not be able to answer me here today, I would be grateful if you could come back to the committee and update us on the progress that has been made to date on defining long COVID as an occupational illness for frontline workers. And allowing them to avail of illness benefit. The second question is related to the illness benefit. It's related to the straw man, and I hope in the context of your consideration of the supplementary supports, including illness benefit, that you could look at this particular issue, which is related to the job seekers issue as well. And that is, the emerging medical evidence is now showing that people that have been diagnosed with long COVID, that the recovery for them involves a phased return to work. Now, the difficulty is, under both illness benefit or disability allowance, there is no mechanism to actually do that. You have to be in receipt of a payment for at least 12 months before you can then apply for a partial capacity payment to allow you to go back part-time to work. Now, while at the moment this isn't an issue because it's taken in excess of 12 months on average for a person with long COVID to actually get to see a consultant or get to a specialist clinic. But hopefully if the Department of Health were to get its act together and allow swift access into these clinics, people could start the rehabilitation far earlier. But they're in a predicament where it's now or no, all or nothing access to work. So the emerging medical advice is that they should go back maybe a couple of hours a day, 1 day a week, increasing that maybe to 2 days a week, and so forth. And that's the medical evidence. The difficulty is that the Department of Social Protection, under the schemes as they're structured at the moment, doesn't allow for that because of the rigidity that's there in the illness benefit. So my question to you is, in the context of what you're doing here, you've acknowledged that COVID has changed the whole dynamic in terms of unemployment payment rates. I'm making the point to you that long COVID now is having a similar impact in terms of illness benefit, that there is an opportunity to allow these people to go back and actively engage in the workforce again much quicker than is currently the timelines that are facilitated within the social welfare schemes. And can you give a commitment here that you will look at this specific illness and look at a more flexible approach to allowing people to return to work on an incremental basis, where it benefits their recovery, it ensures that they can return to productive work as quickly as possible, and reduces the overall burden on our welfare system? Thank you, Mr. Hession.
Thank you, Chair. On your first request for an update on the engagement with enterprise trade and employment and with health, we're going through it. We've been back and forth on various points, and so at official level my team are still engaging with colleagues in health to try and tease out a bit of the back and forth, so we're not out of that discussion point just yet, so that's still going on.
So this discussion is still ongoing with the Department of Health officials?
That's right.
In relation to that?
Yeah. In terms of your question about long COVID, we are doing a separate straw man on disability payments. And I know this is an issue that you raised with me in the context of a previous discussion, and I have asked my team to look at that in the context of the reforms there. And I know Deputy Creevy will be aware of this as well, because your familiarity with partial capacity benefit, that you can't work on IB and invalidity pensions, so partial capacity benefit is supposed to be a way of helping you integrate that. There are certain time thresholds that kick in, and I think that's the core of your point, that a person may be ready to engage sooner, but they're not ready to leave the payments entirely, and there needs to be a sort of transition.
And that's the emerging medical evidence in relation to this particular condition. Yeah,
and that's something we're looking at. I think in other jurisdictions, like I know in Northern Ireland, for example, there is, I think good examples of integration between the sort of welfare system and the health system, in terms of the occupational health, and your sort of your position on the payment is also linked to an overall wraparound around your physio, your other occupational treatments, and there's things we can learn from that. But as you know, the straw man is looking at sort of, for disability, is looking at sort of the structure of long-term payments, but also anomalies and the flow through. We have a very low exit from disability payments, and some of that's around the issues you're raising, some of it's around concerns about secondary benefits, concerns about and lack of opportunity. The one thing I will just say is that it's not, we will look at that if you like, that scenario, if you like, rather than the specific condition. An illness benefit doesn't work on the basis of different treatment, different conditions. It's as though whatever condition you have, if that's affecting your ability to work, that's the gateway onto the scheme. So, but we understand the point you're making, and since our last engagement here, I have asked the team to sort of tease that out and look at how we might address that.
And my question to you is that, are you looking at that in the context of the straw man, or looking at that in the short term? Because, look, the hope is that eventually the vast majority of people who are experiencing the symptoms of long COVID can return and return to actively to the workforce. introducing something in 3 years' time or 4 years' time is of little use to the, the tens of thousands of people that could be caught in this problem at the moment. And what I'm saying is, in fairness, I have to say the Department of Social Protection has been very proactive in looking at this as an occupational illness. Bizarrely, it's the Department of Health that's dragging its heels on it, and yet their staff are the ones that are reaching an income cliff edge in June, and yet they don't seem to be making the priority that it should be. But having said that, the difficulty is here now that these people need that flexibility now. The medical advice and evidence is that they need that incremental return to work. And the difficulty is that that flexibility isn't there. Now, I accept the definition of illness benefit requires that it is a long-term illness of a minimum of 12 months, and that can be certified in your own. Doctors are certifying that in terms of the payment at the moment. But there's an opportunity to assist these people to get back into the workforce far quicker, and rather than locking them out of employment, tying them into a welfare payment, there is an opportunity to use this as a novel solution to a novel illness that we have at the moment, which we had to do with the pandemic unemployment payment, we had to do with the enhanced illness benefit, and I'm making the point that the department needs to urgently look at this as well, not wait for a straw man at some future date.
Okay, well, we'll certainly take that back, Chair. Thanks.
Thank you.